How can geriatricians help older people with multimorbidity? In this video, I will tell you the answer. Multimorbidity is a word that describes when a person lives with two or more long-term conditions. It becomes more likely as people get older. Currently, around 60% of over 65 have two or more long-term conditions, and about a third have three or more long-term conditions. Multimorbidity is important because individual conditions and the treatments for those conditions can interfere with each other. For example, people who have breathing difficulties due to heart or lung disease might struggle to meet the exercise requirements to lose weight for their type 2 diabetes. With regard to treatment, an example would be that some painkillers for osteoarthritis can make heart disease worse. Things become more complex the more conditions that you have, and as each individual condition becomes more advanced over time and needs more complicated treatments. A study conducted by a research team in Dundee in Scotland looked at what treatments would be required for a 75-year-old woman with heart disease, chronic obstructive pulmonary disease, type 2 diabetes, osteoarthritis and depression. They identified that strict adherence to national and international guidance would mean starting 11 drugs. In addition, the patient would require 9 separate lifestyle changes, including difficult things like doing more exercise, changing their diet, losing weight, and stopping smoking. Finally, they would need 5 annual clinic appointments and to be seen by up to 4 further healthcare teams. Each of these recommendations are evidence-based, based upon randomized controlled trials. They should make a difference. Clearly though, for the poor patient at the middle of all this, things could become unbearable quite quickly. Things can get even more difficult if one of the long-term conditions is dementia, because people with dementia can struggle to manage treatments and because they often need the support of their family members to do so. This can make managing long-term conditions even more difficult because you're not sure what treatments an individual patient has managed to take and which ones they've struggled with. Fortunately, healthcare professionals are starting to become aware of the risks associated with managing multimorbidity, and we now understand how to reduce the risk of harm. Geriatricians have a role to play in this for older people, those over the age of 70, who are starting to become more disabled and physically frail. What we do is we think about the patient as a whole rather than thinking about their individual conditions. Firstly, we conduct a comprehensive assessment. This includes a detailed review of all medical conditions, of mental health and well-being, and of an individual's ability to conduct day-to-day tasks. We look at the environment that they live in and the support mechanisms, including family helpers, that they have on hand to enable them. To do this, we need a multidisciplinary team. This usually includes a nurse, a physiotherapist, an occupational therapist, and a doctor. But for people with particular health requirements, additional help may be required, for example, from a social worker, speech and language therapist, dietitian, podiatrist, orthotist, or dentist. Once the team have gathered together their assessments, one or more members of the team should sit down with the patient and their family to consider what treatments are possible and how these match a patient's priorities. Individual patients might want to minimise drug treatments, whilst others might want to take all available preventative therapies. Some patients might have anxieties about management of one particular long-term condition, for example their diabetes, and they might want for this to take priority. They might also have particular cultural or religious views that determine what approach should be taken to their healthcare. Once the management plan is agreed with the patient and their family, it's important to set a date for review. Long-term conditions change over time, and management will be an ongoing process rather than a once-off snapshot assessment. One of the things that can be really challenging when managing multiple long-term conditions, particularly where one of them is dementia, is that people live with these conditions right up until the time of their death. It can be difficult to spot when a patient is moving from an active phase of treatment when they need multiple medications to one where they're approaching the end of their life. This can be a bit easier when healthcare teams have built relationships and grown to understand a patient and their family's preferences over time. But this is particularly important when they're considering how to support family carers and help them to come to terms with such difficult decisions. In most countries, there aren't enough geriatricians for every older person with multiple long-term conditions to have their care coordinated by one of us. But we can provide expert advice to support the multidisciplinary team of healthcare professionals and also help primary care doctors with difficult decisions along the way. We can also meet with patients and their families to give advice when they're facing particularly challenging situations that they're not quite sure how to proceed with. So what should you do if you're a patient living with more than one long-term condition, or if you care for somebody in this situation? Well, firstly, speak with your specialist and your primary care doctor about how your various conditions interact. If you're happy with your current care, stick with it. If though, the medications or attendances at hospital are starting to get overwhelming, then maybe it's time to see a specialist team in care of older people for comprehensive geriatric assessment. They can then work with your primary care doctors and long-term condition specialists to establish a sensible way of working that takes account of all your conditions and what you want for your health, and help you to find a balanced and sensible way to manage your conditions going forward. And remember, you're always welcome to consult with professionals specialising in geriatrics and gerontology, specialists in care of older people. We really welcome your approach and working with you. Thank you.